Hello, DOGTV. Joe Myers here, back in my home office. I hope you're all staying safe. Back with another episode of DOGTV Chats. We have an incredible guest today. I want to thank you all for participating in our live chat yesterday with Dr. Paul. And then today, an incredible guest. And then tomorrow, we have another guest, Dr. Courtney Campbell. He's a board-certified surgeon. Talking to you about the state of the vet industry and what's going on there. But without further ado, please let me welcome my guest, Arden More.
Pet safety dog, Kona.
Hello, Arden. You are America's pet health and safety coach. What does that mean? What's your primary role as the pet health and safety coach for America?
Try not to trip in public, But no, seriously, I'm a master in pet first aid. I teach a lot of veterinary approved classes of different levels. And my goal is to keep all our dogs and cats safe and their people too. So I'm blessed to have Kona as my teaching assistant with pet safety cat Casey.
Oh, hello, Casey.
Probably the most traveled cat in the country teaching behavior and pet first aid, and today's his birthday. No fooling, he's 6.
Oh, well, happy birthday, Casey. Well, we learned yesterday, and we all know that veterinarians across the country are closed down for only emergency services.
Yeah.
And so that puts the pet health and safety into the hands of pet owners across the country. And so here at DOGTV, we want to make sure that pet owners are as qualified and informed as possible for some common things that could occur during the season. And you could call your vet and say, sorry, it might not be an emergency. Can you handle it at home? And this instructional video is here to give you that. So we're going to cover 4 things. We're going to cover what happens if my pet chokes, some unexpected household dangers. What are the things in your house that you didn't really realize, and now you're home more and your dog's home more, that could be dangerous? What happens if my dog starts bleeding? And what happens if my dog needs a splint? That might not be considered an emergency situation by your local vet, unless there's some extenuating circumstances there. So let's get started with choking. What happens? What are the most common ways a dog would choke, and what would you recommend a pet owner do when their dog or cat chokes?
Well, the first thing is to get in the right emotional state. So screaming like a little girl, running up is going to just spike their fear, anxiety, and stress. You got to listen, and you approach when that choking, that coughing sounds like a, it's called a stridor. And that's your clue that something in the throat is partially blocking the throat. This is when we need to come in and do the doggy or kitty Heimlich. So with the help of Kona, I'm going to show you really quickly. Come on up, Kona. Kona goes, this isn't my first rodeo. All right. You'd make a fist, and you pretend you're British and having tea, and you make a cup and saucer.
Everybody is watching. We better do this along with
home. We're going to be British, cup and saucer. Now take your hand and feel down the rib cage to the end of the sternum. It's a lot farther than you realize, and it's that little gooey spot. Now, for big dogs, you can come this way. We're going to show you on little dogs in a minute. Or medium-sized dogs, put that fist right at the end of the sternum, that gooey spot. Take your other hand, like a cup and saucer, and everybody go up and forward. So it's up and forward, like a backwards J. You do it on the exhale. So you do 5 of these. Inhale, thrust, inhale, thrust, inhale, thrust, inhale, thrust. Inhale, thrust. Did I do 5? Inhale, thrust. Come over. You open the mouth and you do a finger sweep.
Okay.
You can also do back blows. Now, if you got a little tiny dog or a cat, this is Casey. Come here. Sit, boo-boo, sit. Kona, sit. Doesn't it look like he's saying, all I need is a beer and a remote? You put him against your belly. And you cup your hand right at the end of the sternum, and again, it's the same movement. In and forward, in and forward, in and forward, in and forward, in and forward. Open the mouth, pray for me.
Will do.
Sweep and get that object out. And when you do, put it in a spare poop bag, because if you just leave it on the ground, what's going to happen? Let me try it again.
Yeah, that was a fun little massage, Mom. Thanks for that.
Yeah. Or another dog will try to grab it. So
Yep.
just really listen and then come in. But if you run up to a dog while they're choking, they're going to run away. They're going to try to bite you.
Yep.
Or worse, they're going to swallow it harder and they can cause throat damage. So you have to be a little sneaky.
The first step is be calm, which is really difficult for a pet parent. But
yeah, if you take a breath,
yep,
let it out, and you say to yourself, I have permission to freak out later, it works.
I love it. Be in the moment. Be in the moment, and then end of the sternum, and then you're gonna up and out on the exhale.
You got it. Man,
Love it.
You're a good student, Joe.
Thank you so much. I get an A for the first one. If you guys have any questions about general pet health, general safety for your dogs, please feel free to ask them to Arden. If you have any questions about the specific lessons we're going to, ask those as well. So we've covered choking. I think we're all pros now. As long as we deal with ourselves, we can take care of our dogs in that situation. And although that's an emergency situation, the best thing to do is try to be calm and handle it in the field. Excellent. Now we're going to go into unexpected.
Yeah.
Love this. Unexpected household dangers. We all know the big ones, the chocolate, the grapes, the electrical cords, all those things that, are very obvious. What are the unexpected items and household dangers?
Well, right now, thanks to COVID-19, we are all home, hunkered down together. Our dogs, our cats, our kids, our parents, us, maybe our grandparents. So kids are getting bored. I can just imagine no house in America is winning the Clean House Award because there's toys sprinkled everywhere. However, I just grabbed a few. This is a little toy train. Let me see. Right. What if Kona accidentally woofed it down? She could choked on it. Your Legos. These are some other little figurines. So make sure with your kids, let them have responsibility in how much they want to be good and safe for their dog by picking up their toys or maybe having them in another room and then putting them in a plastic container or something with a lid on it. Because these guys are going to swallow it. It has our scent on it. And a lot of dogs, Kona goes, this is how I investigate my world. I swallow. All right. I use my mouth. This one, though, is a big surprise.
Yep.
Getting a little bored. Some of us are actually working out. Some of us are working at eating more snacks. Right?
Yeah. Oh,
so these little empty snack bags, if we leave it and it drops, I'm a dog. It smells really good. I'm going to put my nose in it and do a Hoover dive. The problem is they can actually get stuck and suffocate.
Oh, wow.
Yeah. So this little thing, your kid forgets to throw it away, can actually cause suffocation.
Yep. I know when you're working at your desk, you might, you have a. So would you recommend throwing those in a trash can or something?
Yeah, because I'm a dog and I'm like smelling Joe's empty potato chip bag and it smells good. And oh no, I can't get my nose out.
Oh, wow. Yeah, I didn't even think about that.
Pain guys, but we love these guys. These guys are keeping us sane during all of this. So the best thing we can do is keep them happy and healthy, right?
Awesome. So Legos, the chip bags. We all know we're eating a little more chip bags than we should. So Legos, chip bags. What else do we got?
One more. There's a big craze. A lot of people are trying to eat healthy. They think they got a good fat in avocado. And they're making the avocado toast. Well, you know what this one's doing, all our dogs. They're looking at us with those big brown eyes or blue eyes going, can I have a little bit of that toast? The problem is there's an ingredient in avocados called pyrsin, perfectly healthy for us, but for dogs, it can actually cause not only vomiting and diarrhea, but pancreatitis.
Oh, wow. Okay.
So, healthy for us, no for dogs.
No for dogs. Avocado. Eat your avocado toast, but keep the plate away. We do have a question from the audience. So there's a lot of people. I've heard chocolate is good for stress. What should somebody do if their dog ingests chocolate? what should happen to them immediately? Short term.
Really, yeah, you got to monitor, because the darker the chocolate, the more the ingredient of theobromine, which is nasty to dogs.
Yep.
So there's always that lab that eats the whole bag of M&Ms and has no reaction. And then there's a little Yorkie that takes a nibble and is really sick and having vomiting, diarrhea, and passing out. If your dog is showing signs of reactions to it, getting lethargic, having vomiting and diarrhea and all that, you do need to grab it and monitor them. You look at their gums. Their gums should be a bubblegum pink. If they're starting to turn whitish, that's a dog that's going to go into shock. Gums don't lie. Now, let's say your dog got into a big pile of chocolate, but they're not burping. Blech. This is the only time you can use hydrogen peroxide, 1 teaspoon per 10 pounds of pet, and there's a pocket in their mouth that you can put it in. Best way to do it is you see the big canine, see little tooth pocket. So everybody at home, lift your dog's lip. You're going to see big tooth, little tooth pocket. Put a syringe there, and it's 1 dose every 10 minutes, only twice. We really recommend under a guidance of a veterinarian. Obviously, we're pretty busy and everything's crazy right now. Only time to use hydrogen peroxide is when a pet gets into something. They're not vomiting. You need to get it out. And it's 1 teaspoon per 10 pounds of pet.
1 teaspoon, 10 pounds of pet under the guidance of a veterinarian. Best case scenario in that situation. But we know we live in a different world than we did about 3 weeks ago. So use your best judgment, always under the guidance of a vet.
And last tip, please look around before you do it, because if you have a dog like Kona, should we tell him what you do? Okay. Sometimes if I leave the TV remote out, I like to chew it.
Oh.
So if they got into your remote or something else that has batteries in it, and their teeth got through the batteries, that's battery acid. If you put hydrogen peroxide in, that's not good. That's vaporizing their belly. So really be like a pet detective. Check around.
I love it. Get your hat on. Get your pipe.
Yeah. Just the packs. Just the packs.
Awesome. So please, audience, ask more questions. This is 100% live. We're looking at your questions. Ask them more questions. So our next category, we've gone choking, unexpected household dangers, talked about chocolate a little bit. What about bleeding? Obviously, there's a ton of situations which can cause your dog to bleed. You're going on a walk. He steps on the rock. You're going on a walk. He gets, there's a stick. He runs into another dog. What should a pet owner do to manage when their dog is bleeding?
It's important to know there's 3 types. It's the little capillary. If we look at Kona's ear, everybody check your dog's ear. You can see these little blood vessels close to the surface.
Yep.
They're just nicked a little bit. That's no big deal. A little soap and water, pressure, no problem. But I tell my students in my Pet First Aid for You classes, fall into the gap. G, gravity. So we're going to say Kona really got a bad wound on her front paw. Her heart is here. So if you can elevate above the injury, that's going to slow blood loss, right?
Okay.
A is your artery is your ally. So in this case, dogs have carotid, brachial, femoral, and my favorite at the tail, caudal. So you let your artery be your ally. And P is pressure. Pressure is your pal. That helps slow really serious bleeding, like for an arterial wound. You know what, guys? If you don't put pressure, elevation on a dog that has an arterial bleed, they're gonna, if they lose 30% of their blood volume, they're already in shock.
Oh, wow.
And it only, unfortunately, takes 5 to 7 minutes if you don't do anything on a bad arterial bleed for a pet to bleed out.
Oh, wow. That's quick.
So that's a serious one. This one's going to happen, though. Pause up, Kona says. Pause up. We always have these orphan socks.
I have a whole drawer.
All right. Use them. So on a hike, bring a spare sock. Your dog gets a bloody paw or pulls out a nail. And you can use a poop bag or a scrunchie or shoelace. Yep. Again, your dog has to be elevated, because if they stand up, the paw is below the heart, and guess what happens?
Yep.
goes through blood. So use something like this. This is just a nice makeshift idea.
And if you have any questions, contact your local vet, emergency vet. You know, the big injury you were talking about before would certainly justify as an emergency situation.
And when you do call, guys, please, because this is what all my veterinary friends and staff say. When you call and they go, ABC veterinarian, may I put you on hold? No, dog not breathing, or dog has an arterial bleed. Please don't scream, cry, save my dog, because every minute counts.
Yep.
Remember, you get to freak out later. So
Agreed.
see what it is, how far away you are, and they're going to guide you.
Love it. Awesome. Be honest. Don't go on hold if it's a serious situation. If it's not serious, obviously, you know, be respectful of your fellow pet owners. But thank you so much. That's a super big tip. So we talked about choking, household dangers. We've discussed bleeding, the 3 types, and the courses of action to try to remedy them in the situation. Now the next one is splinting. And this is probably something no one has thought about before this situation, but more walks, more runs. So what is the most common way in which a dog would need a splint, and how should we apply it?
Good question, Joe. You know, we have a back porch right off our, and then Kona gets so excited in our fenced backyard, she flies out the door. Well, what if she misjudges a step? We don't know if the dog is limping, if it's actually a sprain, or if it's a hairline fracture, which is called a simple fracture. So either way, we want to splint that area. Now, caution. If they break through the skin, their bone, that's called an open or compound fracture. You do not wrap that, because you're going to mess up the bones and basically bake in bad contaminants. But let's talk about the sprain. Let's keep it simple, Kona says first. Check my paw. Make sure I don't have anything like a foxtail or a stone or a burr that's making me limp and not put weight on it.
Okay, paw first.
Number 2, all of us are ordering everything at places like Amazon and Chewy.com, and we're getting all this plastic bubble wrap. Use it. So I wrap it. It always should be a cushion first. Then use like paint sticks, ink pens, emery boards, popsicle sticks cleaned. And you need to call what's called a stabilizer on top and bottom. Then you can just wrap it. And when you wrap it, you've got to make sure that you wrap above the ankle. Above the ankle and above the elbow and below the ankle. Duh. And that way it keeps it rigid.
Yeah.
And so Kona's being very nice.
Good job,
Kona. You need to be muzzled, this dogs, because you don't want to be chewed on while you're doing first aid. And then you just tie it always in a bow, never a knot.
Oh, that's awesome.
Easy to take off, and you don't get vet techs mad. Close up, everybody! I love dog TV.
Amazing. So you would do that, keep them off it as much as possible. Obviously, given the size of your dog,
ice and all that. Make sure. But you can close them up in an area so they're not running around. But think about it. They're so excited that we're home. Yeah. They want to go running and playing more. I mean, we take our walks now twice a day, and we see all new neighbors we didn't even know had dogs.
We are it is the same here. It is like all of our neighbors have dogs. Everyone's adopting a dog for the first time. So huge opportunity to be the best pet parent you can be.
Yeah.
That is really good. So make sure if it goes through the skin, call immediately. That's an emergency situation.
Yes.
And obviously in any of those sprain situations, you'd want to call your vet, correct?
Yeah, because they may be able to give a pain med or an anti-inflammatory or something that you can pick up safely outside the door of the vet. So, the vets are being really innovative and keeping everybody safe. So, if you notice that it's getting more swollen and things like that, these are all signals. Be a pet detective. Make sure you say specifics. 4 hours ago it was this big and now it's this big. Give duration and change to your veterinarian, and that helps them be able to get the right treatment.
Excellent. I want to thank to some of our audience. We have Christine. She says she loves Dog TV and this information. Christine, we love you. Thank you so much. We have Kavita. Useful information. Tara and Becky. Thank you guys so much for participating. These chats are way better and way more informative the more you participate. So thank you guys so much. Any general questions for our audience for Arden More about pet health, about safety tips, please feel free to put those below, and we'll try to ask her as many as possible. We'll get to them. What is the first thing you teach somebody about pet CPR, pet safety, when they start one of your classes you mentioned earlier?
It is the mental state, your emotional state. Our dogs and cats smell it. So if we're freaking out, they're going to be a little harder to wrangle. So that breath of air and realizing I can freak out later when the pet is stabilized are two really valuable tips that we give. And the other thing is be safe, guys. I teach a lot of first responders. I teach an instructor training program with Pro Pet Hero and a regular class with Pet First Aid for You. And the first responders, EMT, firefighters, police officers have all taught me to teach you do a 360. Look forward, left, right, up, down, and behind you as you slowly approach a situation, and then tap all your senses, smell, hear, look for any kind of dangers.
Oh, smart.
You don't know, there could be some Shih Tzus with ninja knives, so you just got to be careful. So approach the scene, even in your own house, because maybe your dog is out for the count because a burglar's in your house.
Okay.
So breath of air, 360, freak out later.
I love it. That's so important in that situation. You obviously want to go to the rescue of your dog and be the hero, but you need to understand that the situation is just bigger than one focused thing that you're seeing. It could be a big situation, and focus on there. Where can people find out more information about your classes, about your pet safety and health tips? Where can people find out more information about Arden More?
They can go to ardenmore.com or Pet First Aid for You or Pro Pet Hero. And my motto is I try to bring out the best in pets and their people. And I'm very blessed that I have Casey and Kona as my team.
Awesome. Casey.
And I love DOGTV, so thank you very much for the invite.
Thank you so much, Arden. I think it was incredible information, especially after our talk yesterday with Dr. Pohl about the fact that vets all over the country have been given strict instructions to only do emergency care only. And a lot of the stuff we covered today would not be considered emergency care.
No, the whole role of first aid, pet first aid, is to stabilize, immobilize, and get to the veterinarian.
Yep.
So guys, all of us that have pets, we can literally do our part to help save our pets' lives and put them in the hands of professionals.
Exactly. Just like first aid for humans, that one little thing can mean a huge difference down the line when they're with a vet. And wow, because you did X, now we have the chance to be veterinarians and to save them as much as certainly possible. So you do incredible work. It's always fun. You're always a breath of fresh air, huge personality. So it's absolutely amazing. We want to thank you so much for supporting DOGTV. For anybody who doesn't know and who's at home with their dog, maybe working, or if you're an essential worker and you're going to work, turn on DOGTV this week. Give them something to enjoy, relaxes them, giving some entertainment, and they can be safe in front of the TV. So head over to dogtv.com/wecare to get yourself one free month of DOGTV. We're streaming all over the country and the world, in Brazil and all over the country. With our streaming platform as well. So go check that out. And if you have a dog, and just like Kona here, who is a star, we're also starting the Dog Star. This is our chance to highlight the DOGTV community, highlight dogs around the country. So head over to dogtv.com/dogstar and submit your video. Arden, you better submit a video of Kona.
Oh, not Ice Cream Kona.
Ice Cream Kona. Maybe sing the song.
Okay, right.
There's a song. So Arden, we hope you submit your dog as well.
Okay.
Thank you guys so much for joining us. Tomorrow we'll be talking to Dr. Courtney Campbell. He's a board-certified surgeon and veterinarian from Vet Candy, Purina's Media Personality of the Year, and he'll be talking about the state of the industry in the veterinary world. So this is perfect right after we talk about Arden, pet health and safety coach. Arden, thank you so much for joining us.
Pause up. Thank you so much, Joe. It was a great time.
Pause up. Everyone do it. Pause up? Okay. I didn't know if we pause up, everybody. Thank you, Arden. Thank you, everybody, for joining us. We'll see you tomorrow, same time, with Dr. Courtney Campbell. Check him out. He's incredible, a board-certified surgeon talking about veterinarian and the COVID-19, what's happening, how's he dealing with it, and information to make you the best pet parent possible, which is DOGTV Vision, giving you this information and opportunity to become the best pet parent possible. So Kona, Casey, Arden More, pleasure. Oh, that's a dog star right there. Go submit him right now. He's ready to go. He needs to be. And with our dog star, you're actually featured on network television, so available in over 70 million homes. Dear God, I mean, what best? That's the best thing we can do right now is spread love, spread joy with our incredible fur family members. Arden, always a pleasure. I'm going to go check out your site. I'm going to go enroll in that, be the best parent possible. Thank you, Arden.
Be well, everybody. All right.
Thank you, DOGTV, chat, family. Thank you so much. Go check out DogStar. Go stream DOGTV if you haven't. Go check our exclusive Facebook group out as well. The DOGTV Pack. We share really funny videos, ask for advice. You get to help us create the best DOGTV experience absolutely possible. So go there, join there, and we'll see you tomorrow with Dr. Courtney Campbell. Have a wonderful rest of your day, and we'll talk soon.